아주 애들이 머리를 아주 이쁘게 잘. 빨리 수업 들어간대는데 봅시다.
All the iodine is sucking it out of the rest of the gland, actually. None of the other parts of the gland are able to take the iodine because this is overactive. There's a toxic multinodular goiter, so multiple nodules within the neck. And then this is one, again, I don't know why, but the board seemed to really love this, so I show a picture of it. This is called struma ovarii. This means thyroid tissue within the ovary, within a tumor within the ovary. So it happens in less than 5% in all of these tumors, but it's something that the boards really like. And I've seen patients actually with thyroid cancer in their ovary. But the classic is a patient comes in with hyperthyroidism and then they come around somewhere where there's a mass in the pelvis. And so it leads back to this struma ovarii. So something to be aware of. So let's come back to king thyroid when he's not feeling so good, right? And so he's not producing the thyroid hormone that he should be making. And then you have hypothyroidism, right? So the symptoms you feel it's just the opposite, you know? You're cold, you're just very tired, you have mental brain fog, you're constipated, weight gain, your voice may be hoarse due to some accumulation of glycosaminoglycans within the vocal cords as well. You're not sweating as much, bradycardia, so everything just slows to a halt, really. So it's the exact opposite of hyperthyroidism. So this is something we see quite often, and we treat this. You guys, I heard you talking about levothyroxine, so we use thyroid hormone to treat hypothyroidism. So again, let's talk about cold intolerance and how would we, or cold sensitivity, how would we explain that to patients?
지금 다 학부형들이 와서 보는 거야?
So in Southern California, I think we think of things a little bit differently here. So those visiting, right, this is cold for us. So that might be, we might just have an inherent sensitivity to cold already. But this is, again, everybody else is feeling warm and you have a puffy jacket on in the house. So what are some other things we need to think about in terms of hypothyroidism? So Hashimoto's, which is, again, the other side of Graves' disease. It's an autoimmune disorder as well, and it is causing inflammation to the glands to the point where it's not functioning any further. Remember myxedema, we talked about pretimbial myxedema. Myxedema coma is something completely different. This is a severe form of hypothyroidism. The patients are in critical condition. They're in the medical ICU. They have altered level of consciousness, bradycardia, hypotension, respiratory failure, and hypothermia. So these patients are very, very sick when they come in. And the other finding that you don't see in a lot of textbooks, but I've seen in a lot of patients that have come in with myxedema, is if you were ever to examine their skin, it feels like dough. So we call it doughy skin. So those of you who made pizza or bread, and if you kneaded it, you'll never forget it if you ever have a patient, because it feels just like kneading dough on their skin. And the other thing is dry skin, severe dry skin in these patients. I had a colleague that I always remember that he talked about this because it was a patient who was 102 degrees in Chicago where he was doing his prior job. And very hot, but they found this woman in a trailer. It was started to burn down, so somebody called it because she had a couple space heaters on in her trailer. So she was really cold, right? So she had cold sensitivity. And so it started to burn down. She was found unconscious. And when they brought her into to the emergency room, they were examining her, and she had all those different signs. But when they removed the covers to try to examine her a little bit further, all of the skin flakes, like snowstorm in the rest of the room, just came up because of all the dry skin. So I always remember that description. So again, she had a severe cold sensitivity. So moving forward, we're just going to have a brief discussion of the lymph nodes of the neck, guys.
타이로이드는 갑상선이라고 할머니 아픈 병이야. 근데 그거 설명해 주고 있잖아.
So just in general, some of the characteristics you need to know about lymph nodes also apply to what we talked about, thyroid nodules. The opposite though, in terms of lymph nodes, where you see these a lot in young kids, and actually the best way to do an examination is to find a young child and to see if they have any lymph nodes in there, because most likely they've had a URI or some type of respiratory illness recently. So I remember when I was going to fellowship, I would try to examine my kid's neck all the time because they always had lymph nodes because they were sick. But there's some certain characteristics we need to be careful of, right? So if most lymph nodes will be about the size of your distal phalanx, okay? On the little finger especially, so that's about 1 to 2 centimeters in most people. If it's tender, it denotes that there's some inflammatory process going on, and that's something to keep in mind. What are some worrisome things? So these are the things I really want you to remember. So if you have a rock hard, right, just like our thyroid node, so you have a rock hard lymph node, that's concerning for some type of cancer or metastatic cancer. If you have a matted lymph node area, so it's like a coalesced bunch of lymph nodes that are matted together, this is also a dangerous and suspicious sign. If you had something where it's warm over the top, it suggests that there's, or it's red, this again, it suggests that there may have a malignancy, but most often it's due to an infection, okay? So we're just gonna move forward again a little bit quicker on these and just kind of give you the main points of what you might find when you're doing your examination. So maybe run through as you're doing your exam on yourself here. We're gonna first talk about our occipital lymph nodes, okay? These are on the back side of our head, and these typically drain the area of our scalp. So many times if you have enlarged occipital lymph nodes, they can be due to a childhood infection or something within the scalp itself. So those are right at the occiput, and so if you feel a rounded prominence there, then you might have an idea of what may be going on. So the other one we're going to talk about here are the posterior auricular. Okay, so right behind the ear, so right there. And these, again, they drain the external part of the ear.
예. 오늘 패밀리 데이라고 밖에서 이렇게 전부 공개 강의 공개 강의를 하니까 너무 좋네요.
He's like, no, I don't want this. It's okay, only for daddy. Only for daddy.
I enjoy to take the class about my thyroid.
Oh,
Wow.
I know.
Yeah.
Interesting.
Yeah, interesting.
Every year, somebody tells him, go, wait, go.
Yeah. Good job. 좋네. 하필이면 갑상선에 대해서 나오니까. 하이퍼사이로이드야. 너무 재밌다.
이제 지금 림프노드가 전부 나와 있어요.
그래, 림프나.
Deep cervical, these are underneath the sternocleidomastoid, and most often this denotes something going on within the oral cavity itself, such as a carcinoma of the tongue. And I'll explain to you guys when we kind of mock up the thyroid exam here, when we're doing our how we might look at this.
그게 상관없어.
We have our posterior cervical lymph nodes. This is one I want you guys to remember because there has been association with nasopharyngeal carcinoma as well as other viral illnesses like rubella. Okay, but remember nasopharyngeal carcinoma if you're feeling lymph nodes in this region, which are just posterior to your sternocleidomastoid. Okay, let's see if I could show you this lymph node here, this video, so you can kind of have an idea. Again, this is a rounded prominence. You can tell it doesn't look very hard. This is a young child. And you can tell by the way she's touching, it's kind of rubbery in texture. It's movable, freely movable. It's not fixed to any of the structures. So this would be something that is less suspicious. This is something that's most likely some type of viral illness. And in this location, it could be due to some type of infection or viral illness, but something we need to monitor. All right, superficial cervical lymph nodes. So if we're feeling lymph nodes in this section, so these are lying over the top of the sternocleidomastoid, the things that we have to think of in this area is lymphoma. Submandibular, as we move down the jawline, right in the submandibular cavity here, we think of dental origin infections or cancers of the mouth and the oral pharynx. Some mental lymph nodes right here at the base, right underneath, at the coalescence of your jaw there. So these, again, go more towards dental infections or cancers of the mouth. And then finally, so if you're sleeping, please peek your head up now, because supraclavicular lymph nodes, you absolutely have to know. You might save your patient's life, or you might catch something very early at least. Supraclavicular lymph nodes are pathologic until proven otherwise, okay? If you feel a supraclavicular lymph node, so a lymph node within this region where this gentleman is pointing here in that picture, this can is very worrisome for a malignancy, okay? So they may be metastasis or a primary cancer within the neck as well. So if you ever feel this is something that you have to get imaging on right away. Well, look at that, I even made it large like that so you guys remember. So a couple things. Now, in real life, this doesn't always shake out, but for board's purposes, I want you to remember a few things. So on the right side, if you feel a right supraclavicular lymph nodes, they're a common site for metastasis of breast cancer, lung cancer, or esophageal cancer. The left, so there is an actual name for the left supraclavicular lymph node. If it's enlarged, it's called Virchow's node. And the one I want you to remember is gastric cancer, named after Dr. Virchow, I believe. So that is the one that you need to remember. But I want you to take away from this, supraclavicular lymph nodes, you have to do a workup, and very highly suspicious for metastatic cancer. All right, there you go, do that one there. All right, so briefly, I would like to have, as Grant's gonna come up, we're gonna do a quick examination. We'll give Grant a hand. I'm gonna borrow one of these chairs here. Grant's gonna do an examination of the thyroid with me. So Grant, come on up here for me. Grant, you consent to me doing this exam in front of 150 people, right? All right, very good. All right, so what did we talk about at the very beginning, guys? The first thing that we want to do is we just want to observe the neck, right? So unfortunately, do you have a water with you, Grant? Oh, look at Grant is ready to go, okay? So appreciate that, Grant. So I'm gonna ask Grant, first thing, put some water in your mouth, Grant, just hold it for a second. So now I'm in position, okay? Go ahead and take another swallow. So just put it in your neck, just hold the water in your mouth, and I'll tell you when to swallow. There you go. Now go ahead and swallow for me. See that? I can see actually, because he has a very nice thin neck, I can see the isthmus going up, right? So we see his laryngeal prominence there. Oh, look at that, he's showing off. Nice job. But because his neck is so thin, you can actually see the isthmus here. So I didn't see any enlargements, anything poking out here. So off the bat, just an observation, I don't see anything major. So the next thing I'm gonna do is I'm gonna use my 2 fingers here. And Grant, I'm gonna have to ask you to help me with this. Can you hold the microphone for me, buddy? Thank you. All right. So I'm gonna take my 2 fingers here and we're gonna follow our landmarks, right? Our laryngeal prominence, our cricoid cartilage, and we know the next bump has to be our isthmus. So we're gonna put our 2 fingers on both our hands right over the isthmus. And what I'm gonna do is I'm gonna start rocking that thyroid back and forth, okay? I'm gonna try to find the lateral borders of the thyroid. Okay, I'm rocking it back and forth, and right there, I actually feel the lateral borders of his thyroid. So I can feel that. It's not very enlarged, right? So this is about the size that we think it should be, right? This is a normal size thyroid. I've never had an abnormal one during this type of thing, so thank God. We would have to go to the clinic, okay? But I don't feel any enlargements right off the bat. I'm feeling over each of the lobes. I don't feel any nodules or anything like that. Now, let's say you're like, man, I can't feel, I'm not sure if that's a sternocleidomastoid. What you might have them do is, go ahead, Grant, turn to the left, right? Oh, look at that. The sternocleidomastoid pokes up right there, so I know, oh, that wasn't it. It was the thyroid. It's right underneath there. And sometimes, if you go look straight again, Grant, you might have to actually try to push in a little bit harder. So you have to use some pressure, but you don't want to use too much pressure, right? I had a first-year medical student one time rotating with me, and she must have really got the message about putting pressure on. I said, I want you to practice on me, then you're going to go do it on the patient. She's like, all right, I'm ready. She did it on me. She about crushed my windpipe. So I couldn't swallow well for the rest of the day. So don't, but you do need some but light pressure, okay? So again, we're palpating, and then the next thing we want to do, right, is we want to start feeling the rest of that thyroid lobe, okay, and we want to make sure we feel inferior. What are we going to do? I want to feel the left thyroid over here. My fingers over where I feel that lobe is. I'm going to take my right hand, and where the border is, I'm going to press anteriorly and medially through this way to try to pull that thyroid lobe up just a little bit on this left side. So I'm going to push here. A little firm pressure. Sorry, Grant. And we tell him, hey, sorry, push on your neck. I know it doesn't feel great. And then I'm going to have him swallow. Go ahead and swallow, Grant. Excellent. So now I can feel the inferior portion of the thyroid as well. And then I would do it on there. So let's do it, Grant. You've been a great sport. So we're going to go ahead, push with these two fingers medially and toward 45-degree angle this way. Make sure your fingers are on that right lobe over there. We're pushing firm pressure on that left side. Don't crush the windpipe. And then you're going to have him swallow again. Beautiful. Excellent job. Okay, give Grant a hand really quick. Don't go anywhere, Grant. And then, just quickly, when you're doing your lymph node exam, there's a couple different ways that you can do it. But in general, the way I like to do it is, again, to use the plump parts of your fingers here, the really sensitive parts. And you can do a strafing technique. A lot of people like to do that. I think that's a good idea to do it like this, where you start in the area that you want to do, so you can follow sternocleidomastoid and straight down. And then what I do like to do is actually stop every once in a while, and then I'll do a little bit of just a circular motion there. So straight down, and just see if anything is going to pop up. I guarantee you, and I know that I see a couple young ones here. Do not approach all these two young ones right now, okay? But find a young person with their consent and touch their neck. I'm pretty sure they're going to have a lymph node in there, okay? But you will be able to feel that and get an idea of that rubbery texture that we're talking about here. But one thing I wanted to show you just with the supraclavicular is this is so important. So you want to expose the supraclavicular region here. And what I'm going to have Grant do is take a deep breath, Grant. And then I'm going to have you blow out and then bear down. We'll do a Valsalva, and then we're pressing right in that supraclavicular cavity, okay? Good job, Grant. Very good. So what we're trying to do is Valsalva.
밥 먹으러 가자. 배고프다. 기운이 다 빠지네. 딴 때 같으면 저거 다 레코딩 하는데 여기서만 그치자. Give thanks to the Lord for His good. Amen. Amen. Yes, He is. Give thanks. 저쪽으로 내려. 알았어. 저쪽으로 내려. 하람아, 저쪽으로 내려와. 저쪽. 할머니가 저 밑에서. 할머니가 저쪽에서. 저쪽으로. 그러니까 저쪽에서. 더 배고파야 더 많이 먹지. 아이, 할머니도 이제 배고프다, 야. 네가 잡고 가니까 좋다, 야. 아이고, 동생 잡고 가는 형아네. 이제 지 형 손잡고 가네. 아이고, 이뻐라. 응? 지 형 손잡고 가. 지 형 손잡고. 이 반대로 가면 지구가 보이고, 위에서는, 아, 저 위에 높은 눈산이 여기서 다 보이네. 내려가서 또. I gotta take them, so that's why. Yeah. Yeah. 조심해. 하율아, 애기 조심해라. 야, 하율이가 괜찮을까? 내려오는데 잘못하면 애기 찌어요. Thank you, beautiful lady. You're gonna be a good model for my family. 됐다. 아, 좋아. 그렇게 좋아. 아이, 좋아. 저기 예수님 사진이 있는데 한번 보자. 아, 이거 좋다. 아, 예수님 사진 너무 멋있다. 그치? 야. 예, 수많은 원소 기호가 이 자연 과학 속에 들어있네요. 예수님, 이 사진 너무 멋있지 않냐? 예수님이 이거, 여기. 아니요, 그래 알아. 여기 동물 생물 다 만드시고 여기 일어나 아담이 일어나 예수님과 저 기도해. 쏘리. 야. 얼른 가 앉아. 서서 여보 당신이 제일 먼저 가. 사람이 너무 많으니까. 거기 서면 되겠네. 거기 서 있어. stand together.
So there's tables upstairs as well. There's elevators just right around the corner on your right. If you'd like to stay there.
Thank you. I probably have something to do just for tomorrow. I didn't know that we
얼른 가.
But it's upstairs, the room I was.
아까 거기 계시면
그래?
하율 아빠가
엎질르지 말고.
얘네들 도와줘요.
할머니가 떠줄게. 니네는 점심만 받아.
아니 엄마 가야지 여기 엄마 보자.
그 가지 말고.
You were always in the passenger seat of the car. It's like, oh.
Is this your family? Some of them. Some of them. Oh, some of them. Nice meeting you. Welcome to Romania.
You guys
하이라 조금만.
Which one? His dedication. Dedication? Yeah.
You're representing.
하라면 할머니가 도와줄게.
Oh, really?
자, 됐어. 두 손으로 들어, 두 손. 할머니 거. 자. 알았어. 이따 할머니한테 줘, 그럼. 할머니한테 줘. 이따가. 알았어. 이따가 할머니한테 줘. 할머니 거 네가 가져가고. 알았어. 여기 많이 컸어. 할머니 거 가져가. 지금은 빨리빨리 가야 돼. 뒤에 사람들 기다리니까. 자, 이거.
Definitely the shroom.
그것도 두 개는 너무 많은데 할머니가 가자. 이런 빵에다가 넣어서 먹는 거야. 자, 이거 빵에다가 넣어서 먹는 한쪽에다가 가보자. 자, 할머니 거에서 가져가면 돼. 이거 전부 맛있는 거야. 알았어. 자, 이건 안 먹어? 알았어. 할머니만 가져갈게.
Texting me again.
이거 허머스잖아.
그래서 많이 넣어. 이거 하고. 와, 이거? 음식 앞에서 이 안에. 그럼 이따 먹어봐. 이 안에.
This is grape leaves, if I'm correct.
이거 뭐지?
이거 다 건강 소스랬지. 조심해.
건강 야채 음식이네요, 전부 다. 됐어? 케이크 하나 줘? 할머니가 줄게. 잘못하면 떨어져. 자,
You want some Sam or no?
두 개를 들기 뭐하니까 접시 두 개 들지 말고 여기다 하나 해. 됐어. 가서 이제 할머니 거야. 아하이,
신기하다. 이거 깻잎.
더러운 소리. 다 됐어. 그 하나만 돼. 두 개씩 안 가져가. 자, 두 개씩. 물은 이따 가져가. 얼른 가, 얼른 가. 들고 가. 아이, 자, 됐어. 이걸로 밥 먹는 게 아닌데. 가, 얼른. 자, 됐어. 여기. 가, 얼른 갖고 가.
이상할 것 같아.
가. 얼른 가세요. 가세요. 이쪽으로 와. 이쪽으로 와. 아유, 밥질.
이게 뭐야 이거?
그건 아니야. 그건 사이다, 아니, 어른들이 먹는 거. 오늘 맛있게 먹겠습니다. 사이다 종류야. 얘네들 이미 했어. 할 수 없어. 애들 이거 끌고 가다가 음식 떨어뜨리면 그게 더. 갈 수 있어? 가. 너네 안 떨어뜨리고 가는 거야? 이렇게 해서 2개 들어. 옳지. 가자. 하일이 조심해. 하일이 엎질릴까봐 걱정이다.
여기 애기 의자가?
애기 거기 앉지. 아이고 애썼다. 떠오는 것도 힘든데 애들이 그래도 오늘은 안 엎질르고 지네 주장대로. 자, 먹어. 감사합니다 하고. 자, 아버지가 기도하고. 그래도 기도하고 먹자. 얼마나 감사하냐. 자, 아버지 기도해 주세요.
와 그래도 멋있다 이거.
멋있다. 기도하자.
기도하유라 기도.
하율이하고 하람이 아빠 우리 학교에 와서 이렇게 하고 또 함께 구경도 하고 공부할 수 있게 해주셔서 감사합니다.
네.
잘하고 또 이 다음에 우리 하율이도 하람이도 하율이도 하람이도 아빠 학교 이렇게 다니면 좋겠습니다. 하나님께서 건강하게 해주시고 맛있는 음식 주셔서 감사합니다. 예수님을 기도합니다.
아멘 했어요. 아이고,
아빠 저거
아멘 했습니다. 네.
너네도
아멘
먹어볼래?
했습니까?
아버님 치얼스.
그 애들이 술이냐고 물어보더라.
거품이 너무 많네.
자, 할머니. 야, 거품이 많이 나니까 조금씩. 옳지, 치얼스야.
자, 우리 같이 치얼스 한번 하고.
그러자, 치얼스 한번 하자. 애들은 조금만 흉내만 내자.
와 귀엽다.
귀엽네 진짜.
하담이도 하고 놀아.
자, 치얼스 하자. 물 넣어줘, 물. 자, 하율이도 좀 주랜다, 야. 하율이 옛날에 그냥, 하율이 많이 주네. 반. 우유 많이 주네, 우유. 하율이도, 오이, 오이.
이번에
됐다.
하담이.
하담이는 먼저 먹고 있어요, 지금. 자, 치얼스. 건강하고 행복하고 하나님 잘 믿고 순종 잘하고 우리 꼬맹이다. 아자자자 잘했어요. 지는 왜 안 주나 눈초리가. 이렇게 해도 물 좀 줘. Hi, cheers. Enjoy your beer. Cheers. 감사합니다. 네.
이거 다 플라스틱이야.
그러네. 과일. 좋다. 감사합니다.
아이리도
먹어.
그냥 가더라. 먹으면 되는데.
걔네들도 저기 안 했구나. 이게 물어보는 게 중요하지. 그렇지. 그냥 먹어.